Good morning. Welcome to this program, Adolescence. This is Dr. Lalita Kaul with Dr. Banik, who is the main speaker for this program. He is a well-known clinical psychologist, and he does the consulting, sees the patients, and even as he is retired, he's very active in community as well as in his profession. So today we're going to talk another aspects of adolescence. Dr. Banik, recently there was a study done by National Institutes of Health, and we're discussing the factors which elevate anxiety in young adults. We have already defined what is a young adult age. So what are the factors, risk factors?
Well, number one is the childhood inhibition, which is childhood temperament characterized by high level of fearful emotions, avoidant behaviors to unpleasant, unknown, unsimilar situations when they do not get much social exposures. And that can lead to serious anxiety during adulthood because they have not learned how to cope with these unknown, unpleasant, strange situations because they have not been exposed to many social interactions in life.
So, Dr. Banik, according to the study, how are these adolescents different in how they handle the stress as opposed to adults? Well, how are they different, how they handle the stress?
Well, everything depends on your basic training at home and school. Now, lately, because of pandemic, lockdown, social distancing and masking, schools are closed.
Yes.
Many adolescent teenagers, their outlet is to meet their friends in school, play, games, socialize, join the birthday parties, or many outings they do. But all of them have been curtailed. They are cooped down in their own home, very little to do, and as a result of that, many of them develop more frustration because there's nothing else to do to release their frustration, and they take it on themselves, called childhood anxiety and depression, or to others like parents, family members. So adolescents, like every human being, are each and every one is individual. It differs from individual to individual. Depends on many factors, their temperament, their genetic constitution, their upbringing, whether both the parents are at home or not, whether they have got more social opportunities to play with others. Otherwise, social development is very important unless you know how to share, how to behave with others. You do not know right or wrong. So that is one of the reasons that we are seeing so much adolescent depression in this country at this time. Not only in this country, all over the world. Because the pandemic has caused all the problems. Schools are closed. Schools is a number one medium for socializations and childhood development.
So how do you think this anxiety, especially pandemic, as you say, because they cannot go anywhere, everything, they are very careless and they're very macho, I don't care, it will not happen to me. How would you say it differs between two cultures, between the Indian and American culture? Like if there are children in the family and parents see one of the children are having severe anxiety, so what will be the cultural differences?
Lot of differences, cultural differences, because in India it's a joint family system mostly. They have got brother, sister, uncle, aunt, sometimes grandfather, grandmother, nephew, nieces. So they're always surrounded by a number of people. So when you have got to interact with different people, it reduces your anxiety. and you also be able to play with them, to interact with them. But here, most of the family is very, it's called nuclear.
So you were saying that the difference between Indian and American culture is what, like 13-year-old in an Indian family, multi-generational. Well, these days, even in India, we don't have multi-generation. People are living separately. But how would parents handle it differently living in India than an American parent? Here again, there will be difference between an American parent and Indian parent. So you can show some contrasts. How would they handle it?
Well, in India, it is open society, neighborhood. You do not have to have family members, Neighborhood, here hardly you communicate with neighborhood. Any neighboring people, everything there, unless you go to school. So there, you have got much better opportunities to socialize, to ventilate your energy. Now, one more thing I want to add here is that adolescence is a stage where, because of endocrinal emergence, they get a great surge of energy and they become very much interested in the opposite sex. To talk to them, to touch them, to hug them, but that is not there. Now in this culture, in America, many of these children have become frustrated because they have no way of getting to know their girlfriends or boyfriends, or touching them, or shaking hands, or even kissing or something like that. So you understand, they have this pent-up energy inside, but they cannot release it.
Yeah, in India, it was a long time ago, my own experience. Living in the beginning with an extended family, it has pros and cons. Looking back, pros is there is always somebody there. You don't call your mother as mother. Somebody is badi ma, somebody is chachi, somebody is bua. In our Kashmiri, we say jigri or babi. And sometimes when I was talking to some pediatrician, they say it causes confusion. But they grow up and they know who is really, and there is family politics. You're not supposed to run. If a grandmother is there, you're not supposed to go to mother, but to grandmother with your problem. This can be also a comfort zone. You have cousins and all, but sometimes it can also not help that much, because I used to hide. I don't know how my mother will react. I won't tell my So it's a different way. And again, they are not more open to, the help of the psychiatrist or psychologist, because in India, they think, oh, maybe this is weakness in the character. You go, even here, Indians living here, sometimes I had some friends who had problems, and I said, well, talk to a counselor or talk to oh, no, my brother said, don't do this. It shows you weakness, for Indians.
No, this is not
so
only
how
this
to handle this? How to handle this?
Well, handle is that make sure you understand that if you do not take action, a stitch in time saves 9.
Yeah.
If you take precautions, preventive measures early, then you can save the life of the child or the teenagers. So it is very important for all of us to understand that if you can get headache, physical disorders, or flu, cancer, typhoid, tuberculosis, similarly mental health is also paramount importance. Body and mind are interrelated. So your mind can also create lots of problems. As I mentioned to you, that many people develop paranoid ideas, develop anxiety, depression, suicidal tendency, guilt feelings, violence, substance abuse, alcoholism, and all those things, all because they have not been able to ventilate their feelings in the socialized manner. So that way you become addicted to substance abuse, alcoholism, and that becomes your friend.
So, Dr. Banik, so how does a mother approach when the child shows all the symptoms? What does the mother do?
Well, first thing, Mother is the best person in this world because she is the first person who has contact socially, emotionally, intellectually, and mentally with the mother. Mother has to make sure that she understands the changes that is happening in him. Suddenly, his mood has changed. His mood angry. But one thing also I have to emphasize, this is some of the characteristic features of adolescence. Almost all, you yourself have experienced that.
Yeah.
You told me last time. So they experience these mood swings.
So how does a parent handle it? In my generation, when I was growing in India, nobody talked about psychologists or counselors.
Well, now things have changed. Now we have got this telephone call. You can call your friends, you can call a psychologist, social worker, you can get suicide line. You have got so much available. Every community, there is a mental health component. And so we have to teach our Indian parents there is nothing wrong in seeking help, because if you would not take proper care at that time, this might lead to serious consequences.
Yeah, that is what it says. According to this study, if you are in a bind and you feel you don't know which psychologist to call, should you call psychiatrist, psychologist? So there is a helpline. You can look, even in India, you can look helpline. They will keep your information confidential.
Correct,
you
correct.
tell them, my son is exhibiting this behavior. I am worried that he may not go into drugs or commit suicide. How can I do? And they help you find the nearest place. They will also help you how to deal with your child, and because there is a crisis. Well, this is all for today. We will continue this conversation with the Dr. Banik to be continued next month. Goodbye.